today's operational information update on the current wildfire situation in BC. For today's briefing, we'll have updates from Rob Schweitzer, Director of Fire Center Operations, BC Wildfire Service, Brendan Ralphs, Director of Response, Emergency Management BC, Don Roberts, RCMP spokesperson, and Dr. Bonnie Henry, Provincial Health Officer. A reminder to media on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. With that, I'll turn it over to Rob Schweitzer, Director of Fire Center Operations with BC Wildfire Service.
Good day. I'd like just to provide a brief update on the current fire status and talk about some of the challenges and successes that we've had over the past few days. So since the start of the season, the BC Wildfire Service has responded to about 1,312 wildfires, and that's resulted in just over 556,000 hectares of area burned. There's currently 249 active wildfires burning in BC. 34 of those are wildfires of note. So 173 of these are due to natural causes and 17 of them are due to human-caused fires. The 10-year average for this time of year is 760 fires for a total of about 114,000 hectares burned. I'm really pleased to report it's been a week of steady progress. And over the past 7 days, the average numbers of new fires per day has remained at around or below 7, and the total number of fires burning at any one time has remained below 250. Visibility remains a challenge due to wildfire smoke and has been hampering our aviation operations. The safety of our staff is always the #1 priority, and we need to follow Transport Canada regulations when we're flying. And even with those visibility challenges, we've flown over 4,000 hours with our air tanker fleet and over 23,000 hours with our helicopters. The rain received over the weekend has curbed the fire behavior, but not enough to make only for a short period of time, allowing our crews to make progress on those incidents. However, the amount of rain was not enough to make any long-term impact, and we'll see a return to those extremely dry conditions to the southern interior today and tomorrow. And conditions for the rest of the week remain variable across the province. It's only early August, and there's still a significant amount of fire on the landscape. Everyone needs to remain diligent. I'd like to take a moment to thank all British Columbians for their diligence and their caution. The vast majority of new starts over the long weekend were due to natural causes. Of the very small handful of human-caused wildfires, all have been declared out, they're under control, or they're being held. I just wanted to send out a reminder to everyone that all BC Wildfire Service personnel and contractors are provided with personal protective equipment. This is related to their jobs and all the COVID-19 related supplies. Personnel adhere to these COVID public health orders and guidelines to ensure that operations can continue safely throughout the province. In indoor areas, all personnel are required to physically distance, wear masks, and sanitize. And this is a requirement that's necessary products are all necessary products are provided, including masks. So be wary of any online requests of the nature that are unsolicited by the BC Wildfire Service, and any donation made cannot be accepted. We appreciate your understanding and support. And so far, the 2020 season has been a very busy one for our crews. And if you're looking for a way to actively support our crews and personnel, we encourage you to post a sign thanking them for their work. So thank you.
Our next update will be from Brendan Ralphs, Director of Response with Emergency Management BC.
Hey, good afternoon, everyone. We at Emergency Management BC want to acknowledge the impacts this wildfire season has had on British Columbians. We know that people lost their homes. We know that at current count, we have over 4,500 properties on evacuation order and over 21,000 on evacuation alert, some of them for protracted lengths of time. We know that businesses have been impacted, and all across British Columbia, people are feeling the impacts of wildfire smoke. I just want to let you know that we're working in partnership with the BC Wildfire Service, with other provincial ministries, with other emergency management partners, and critically with First Nations and local authorities to ensure that British Columbians are provided the supports that they need to make it through this challenging time. Thank you.
Thank you. Our next update will be from Dr. Bonnie Henry, Provincial Health Officer.
Thank you very much. And it is my privilege to be speaking to you today from the traditional and unceded territories of the Lekwungen speaking people, now known as the Songhees and Esquimalt First Nations. And I wanted to bring up two things today. One is, as was mentioned, where the effects of wildfire smoke, both from fires here in BC, but also from our neighbors to the south in Washington state, have been affecting many different areas of the province right now. And just to remind people, wildfires can exacerbate some chronic conditions that people have. Smoky air makes it harder for your lungs to get oxygen into your blood and can cause irritation to the respiratory system, and also can lead to inflammation, which can cause other symptoms for people. So the things to look out for are eye irritation, runny nose, sore throat, mild cough and feeling like you have phlegm in your throat, wheezy breathing and headaches. These are very common and usually can be managed on their own. But for some people, they can have more severe symptoms like shortness of breath, severe cough, dizziness, chest pain, heart palpitations, or heart racing. If you have those conditions, particularly if you're somebody with a history of lung or heart problems, then you should seek medical attention, whether that's calling 811, whether that's talking to your healthcare provider, or if you are experiencing extreme short of breath, calling 911. We know that different people respond differently to wildfire smoke, and some people are at higher risk, and those people are particularly people whose health is compromised by such things as asthma or COPD, chronic obstructive pulmonary disease, and people with conditions such as heart disease, diabetes, cancer, and mental illness are also at increased risk, as are pregnant women and people caring for infants. And you need to, the best thing that we can do is to prevent exposure to wildfire smoke, which means not going outside if possible, keeping windows closed, having filters in your forced air, HEPA filtration in your home if that's possible, or staying with a neighbor or a friend, or visiting libraries, community centers, shopping malls, and other places that have cleaner air. I know this time is challenging because we've also had heat along with the wildfire smoke, and we do need to pay attention to heat because it can be deadly, as we've known across this past weekend as well. So it is important for people to take precautions to protect one another from heat and from wildfire smoke. And if you're somebody who's not affected by wildfire smoke so much, make sure you check on your family and friends who may be. And finally, I just want to, this is an important part in our place in our COVID-19 immunization program. Tomorrow is Walk-In Wednesday. And we know that many people who've been displaced because of the wildfires, because of the issues that we've had across the province, may not have had the opportunity to get their second dose or to get their first dose. And tomorrow's an opportunity across the province for people to walk in and get those important vaccines that will protect you from COVID-19, as we've seen a surge in cases, particularly in the interior, and will also protect those around you. So I recommend everybody who hasn't had that opportunity, tomorrow is Walk-In Wednesday. There'll be opportunities all across the province for people to get caught up on their vaccines. Thank you.
And that concludes the operational updates for today. A reminder to media on the line to please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question today is from Joan Fries, Penticton Herald. Please go ahead.
Thank you. My question is for the gentleman from the Wildfire Service. Forgive me, I forgot your name. What's the prognosis here? Are these fires ever going to be put out, or is it just nature's going to take its course, or what's the future hold for the public here? Thank you.
So there will be some of the fires that are burning in more remote areas, difficult terrain, and where there's less values at risk, that will burn until the fall and even until the snow comes. But our focus obviously remains on those front country fires, those ones that are impacting or potentially impacting communities, major infrastructure, and then other values like range and forage, grasslands. trees, and other indigenous values on the landscape. We remain focused on those, and that's where our resources are currently focused on. Again, we saw a bit of a reprieve with the cooler temperatures and a bit of precipitation this weekend. But I guess in my message at the start, I mean, I don't want anybody to be lulled into the season's over. It is only August 3rd, and there's a lot of summer left. So our focus will remain on those fires. Again, if we continue to see the downtrend and new starts, we'll be able to keep our resources focused on those existing fires rather than having to pull them away to new starts. And so, yeah, that's going to remain our focus to make sure that we're tackling those incidents that have the most impact potentially on communities and other values, and some of those more backcountry fires will likely remain burning until the winter.
So, did you have a follow-up?
Sure, please. And forgive me for being specific, but there's Thomas Creek and the Inkimi Creek fires in our coverage area. So those ones are obviously very visible front country fires. What's the prognosis for two fires like that? Are they going to be waiting until the winter comes, or if things work out, can you put them out before then, or how soon?
Yeah. So obviously I can't predict, and you realize that I can't provide a date. Obviously those are some of our priority fires, as you mentioned, because of their proximity to communities. And we continue to have resources on those fires because of that. Our tactics will obviously, in those specific cases for those two fires, will remain focused on protection of the community, and then outwards from the community into more the crown land and where the timber is. And usually what our tactics are in big fires like that is once the fire is moved away from the immediate threat of the community, we'll continue to build machine guard around the perimeter of the fire, flanking the fire, and then removing the fuel between the guard and where the fire is, so that it actually burns itself out in some cases. And then we just keep working into that center of the fire. But even this weekend, we were able to, and I don't know about Thomas and Inkini particularly, but on a lot of those big fires, we were able to get guards in places where it was too dangerous to go because of the fire behavior when it was much warmer and the relative humidities were much lower. So we were able to make some good progress, but those, if for me to predict the exact date would be foolish. However, those do remain a priority for us, and we'll continue to see crews working on those as long as they're a threat to the communities in the South Okanagan.
Our next question today is from Sinjin Alexander, CTV News. Please go ahead.
Hi, Dr. Henry. We just looked at New York, and they are now requiring people to be vaccinated to go to restaurants and or proof of vaccinations, I should say, in restaurants and gyms. Is this something we should do in BC when you look at the numbers surging?
Yeah, so there's a number of different things that we have in our communities, as you know, and we do recommend that people take precautions, and that particularly if you're not immunized, those settings are more dangerous. But we're not at this point going to be requiring people. There are some businesses, there's some groups that are making requirements that I think are perfectly valid for their own situations, where they have required that only people who are immunized are allowed to attend. We've talked about not having vaccine passports for things like access to public services, but there are some things that are not essential services where it is important that only immunized people get together, especially if it's in a situation where we have more of the virus transmitted, and in settings like indoor crowded settings.
And did you have a follow-up?
I do, thank you, which leads me, Dr. Henry, to, of course, the school year. It's fast approaching September. A lot of them under 12, of course, and most of them have not had a vaccine. I know you established plans earlier. In light of all this, are we going to be changing, do you have plans to change your plans for the school year?
Yeah, and currently we don't. And obviously we're continuing to work with our provincial committee on what are the things that we need to have in place to make the school year as normal as possible for children. We know how challenging this past couple of years was, school year was, particularly how important it was for school families and the school community for children to have in school learnings. And we are committed to that again this year. We want to make sure that as many of those who are eligible to be immunized, particularly teachers and school staff and older students, are immunized. That is really important in the school setting. But we also know that the school setting is not a high-risk environment for transmission of COVID. And what we see in the schools reflects what's going on in the community. That's why it's so important for all of us to be immunized, everybody who's eligible. And as I mentioned, tomorrow is our walk-in Wednesday around the province. Now is the time where people who have just not been able to, have had challenges booking appointments or have questions, can go into clinics across the province and get your vaccine, get your questions answered. Step up for yourself to protect yourself, but also to protect those around you.
Our next question is from Gordon McIntyre, Post Media. Please go ahead.
Yes, Dr. Henry, it's the Lambda variant appeared in BC, and what do we know about it? What makes it so infectious and possibly resistant to vaccines?
Yeah, I've not heard that there's concerns about resistance to vaccines. Most of the variants of concern, and it's not been labeled that yet, it's a variant of interest, are ones that transmit more easily between people. And yes, we are watching it. I can't tell you off the top of my head if I believe we've seen one or two. I haven't seen the latest on our whole genome sequencing that we've been doing on all of our cases here in BC. But the same things apply. We know that getting a high level of vaccination protects us from all of the strains that are circulating right now. We know, I presented the data last week, that the vast majority of people who are getting sick with COVID right now have not been immunized. We think about the people who are in hospital, the people who are in ICU, the vast majority of them, less than 4% of the cases that we've had in the last 2 months have been in people who have been vaccinated. So we know vaccine works, it protects people, and that's what we need to focus on right now.
Thanks.
Gordon, did you have a follow-up?
Just, I guess so. There's nothing extra to fear about this variant.
Sorry, yeah, it's another one of the variants. We know that the same measures that we take to prevent transmission work against all of the variants, including Delta, which is the one that we're seeing circulating quite frequently right now. We're still seeing a lot of the Gamma as well, and a little bit of Alpha, and a smattering of a number of others. But the measures are the same. It's keeping sick people away from well people so that they can't transmit it. And it's all of us being protected from the virus by being immunized.
Okay, thank you.
Our next question is from Nelson Bennett, Business in Vancouver. Please go ahead.
Yeah, I just wanted to ask about our capacity for wildfire fighting, and just to try and find out whether it's sufficient. I'm reading on the Wildfire Service website that we have access to 20 air tankers and 10 amphibious air tankers, and then a variety of helicopters. I'm just wondering, number one, if those are all deployed right now, and number two, whether that's sufficient, or given the long-term trend seems to be increased severity and scale of wildfires, do we have sufficient capacity going forward, or will we need to try to access more this kind of equipment?
Yeah, so currently right now in BC, we have just over 3,300 personnel engaged in the response efforts. And as you mentioned, 211 of those are aircraft. And so the last time I think I heard was about 170 helicopters, and the rest are our fixed wing fleet, our air tanker fleet, as you alluded to.
Okay.
Yeah, so we've had good success in the last few weeks in seeing some of that support, that international support, and the national support. So we have Alberta supporting us here. Quebec was here, and I believe they've returned now on days of rest. We have a Parks Canada team and staff here, and then obviously, as we've alluded to in the past, we have a contingent of Mexicans, the military, as well as the Australians. And so, in regards to aviation resources, we did bring in more this year as the fire season progressed, because of obviously we forecasted the need, and we have solicited and under contract, I believe, every available helicopter in the province of BC, and then kind of eastwards, in competition with the other provinces that are quite busy right now. So we're always juggling and keeping our eye out for finding additional resources, especially when it comes to aviation resources or aerial resources. And we do that on the off season as well. We obviously always look at our allotment and determine, based on history, based on trends, what sort of resourcing we're going to need moving into the following season. We work closely with our international agencies and partners, in the off season to make sure that we're aligned and ready to go if there is a season. And the biggest challenge this year, as we've been speaking about, is the fire season kind of hit all across Canada and Western North America at the same time. And then COVID impacted our ability to access the Australians out of their country as soon as we would have liked. So yeah, we're always reassessing our needs, but right now, we feel that we've employed, a lot of, or all the available resources in British Columbia. We've worked closely with communities and really the forest industry as well. They've stepped up a significant amount. So the big companies and the small contractors in the province to help us out.
Okay, just to follow up, if I may. Yeah, please. I'm just wondering if I understand there are technologies that can improve predictions, detection, and that sort of thing. I'm just wondering if we're using them all, or whether there are technologies that we perhaps should be adopting, satellite imaging, for example, for earlier detection in order to respond quicker. Are there technologies available that we're not using yet that we perhaps should be adopting?
Yeah, so coming out of the 2017 and AET wildfire season, part of the recommendations in the Abbott-Chapman review were around the use of technology. I'm really pleased to say that the BC Wildfire Service, we took it upon ourselves to develop a program within our own organization called the Predictive Services Unit. And it continues to look at new technology, new tools to help us forecast fire, model fire growth, and in and around the detection piece as well. So we do everything from, obviously, we get reports in through our 1-800 center, the public reporting new fires, to having fixed wing aerial patrols on a regular basis, to using remote sensing, as you alluded to not only help us with detection, but help us with fire growth and trying to forecast where an existing fire may move to in the future days to help warn people ahead of those fires. We use that technology to obviously work with EMBC and local governments to help form the recommendations around evacuation orders and alerts. Could we be doing more? I think with that program in place and some of the work we're doing around the technology, we're going to continue to look at that. We've also established a research and innovation division that focuses solely on this sort of area with the vending community. Technology changes so quickly that it's hard to say that we always have the greatest and newest and the best, but I firmly believe that we've increased our capacity in that area quite a bit, and we will continue to do so. This is given the conditions that we're seeing with fire in the landscape now, we need to be able to utilize those sort of resources and tools to protect property and the values at risk in British Columbia.
Okay, thank you.
Thank you, everyone. This concludes today's information update. Our next scheduled update is set for Thursday afternoon at 2 p.m. Thank you, everyone, for joining.